Okay, so today we are presenting mental health and emotional well-being during the COVID-19 pandemic, presented by Dr. Dilini Vidusha. Just a little housekeeping before we get started. If you have any questions about the presentation, please wait until the Q&A session at the end of the presentation to ask your questions. And now, without further ado, we will turn the time over to the presenter, Dr. Dilini Vidusha. Our presenter today is a senior registrar in psychiatry at Teaching Hospital Peradeniya and a lecturer at the Faculty of Medicine, University of Peradeniya. Dr. Dilini, over to you. Yeah.
Okay, thank you. Thank you for the introduction. And I welcome all of you to today's session, and we will move on to the session, right? Okay, I think now you can see the presentation.
Yes, we can.
Okay, so it's actually not a new thing, right? The COVID-19 pandemic, as today's topic, it's regarding the COVID-19 and your mental health, right? I feel that it's the most concerned area in these days in our lives, because it has not affected only to Sri Lanka, and this is a worldwide pandemic that has affected. It can affect various people in various ways, right? You might, some of us more than the others, right? Definitely, considering the university and the university students, that most of you think about the pre-COVID era, that you have to come to the university and have your lectures, you can meet your friends. But what has happened now? You have to continue your education remotely, right? You have to do your studies, you have to work and doing assessments remotely. Actually, it's drastically different than how you was in the pre-COVID era, right? So the people struggle with various things considering the COVID-19. Actually, during the initial phase, what we worried? We worried about our physical health, right? Because we don't know what patient is getting COVID-19, whether we are going to die. Like that, we had several concerns. Later, it affected our lives in several other ways, considering our mental health, our economy, and such. So, you may lose your roommates, and you may not be able to come to your faculty. Considering the university students, actually, I think that most of the time the first years, right, as we also can remember during our first year, anyway, it's a stress, right, to come into a university, that you have to be separate from your parents, you're in a totally new environment with new people, right? So anyway, the first years are in stress. On top of that, when the effects of COVID-19 come upon to you, what happened is that your stress get doubled, right? So you may feel that you find it difficult to tolerate the stress at some times, right? So it has caused some added stress. You might have the double your burden in the life, right? So we all handle so much of uncertainty during this time, and so our uncertainty is a major concern. When we considering the COVID-19, why we are getting some mental health issues is need to be concerned, right? So COVID-19, it has caused the uncertainty and fear. Uncertainty means that you are not sure what is going to happen in the next few minutes. During the initial period, actually, what was the uncertainty? Uncertainty means that astirai, right? You are not sure what's going to happen, who is going to get the COVID-19, or who is going to die, whether your close relations are getting that. The situation is very uncertain. You can't predict that. This uncertainty is one of the major things that can cause various effects in our mind, right? And on top of these things, the individuals are, you may have some individual uncertainties. Being a university student or work, you are doing some job, you may have some individual concerns regarding the university, that university students are not know that when they are going to start their proper courses, right? You don't know whether you will be able to come at which day to the university again, whether you are able to come and meet your friends. All of these things that will create an uncertainty in your mind, right? This uncertainty is a thing that can cause several effects in considering with your mental health, right? Okay, then there are several other things, that social distancing and isolation. Earlier, what happened? Now you come to the campus and you can meet your roommates, you can meet your friends, you can have a nice chat with him, you can have a tea at the canteen. It's some kind of routine like that. But what has happened after the COVID-19? There are some strict restrictions that you can't freely go and meet your friends. Then you feel like that you are being distanced with your close relations, close friends. In that kind of a situation, you feel isolated, right? And you may feel the grief. What do you mean by grief? Grief means when we lose something we love, right? The psychological things or the phenomena which occurring in our mind due to the losing of our loved ones, losing of our routines. We had a very organized routine earlier, but due to COVID-19, you have lost everything, most of the things, right? So you can get grief. And not only those things, you may have some economic issues. Maybe not you, maybe your parents, right? They find it, they may be struggling how they are going to pay for the expenses of their university students. Then these things also have an indirect or direct effect upon every one of us, right? So there are enormous reasons why COVID-19, not only the direct effect of the virus, which can cause the brain effect, other than that, several other reasons can cause mental health issues due to COVID, right? So now think about yourself, right? Think about yourself. Now I have mentioned something. How do you feel? Right? Most of thing during our clinics also, we have met people that they have anxiety symptoms, right? Anxiety, increased anxiety symptoms. What do you mean by the anxiety symptoms? I think some of you may also have felt those things. Sometimes we feel like we don't know what to do next, right? We get palpitations and you sometimes feel like that you are in some other world. When others are calling you, you can't hear. You can't concentrate on your activities. ඔයාට අවධානය දීලා ඉන්න අමාරුයි. හැම වෙලෙම පපුව ගැහෙනවා, උස්ම ගන්න අමාරුයි, right? Difficulty in breathing, you get sweating in your hands. Then these are the anxiety symptoms you can get. Right? Some of you may have these symptoms. And when the anxiety symptoms increase, you may get panic attacks. I know think about yourself and whether you are having panic attacks. What do you mean by panic? You get an episode. At that time, you are having the symptom cluster, palpitation, difficulty in breathing, and you feel like something terrible is going to happen, right? ඔයාලට දැනෙනවා ඇති සමහර වෙලාවල් පපුව වේගෙන් ගහනවා, you get palpitations, right? Then you feel the දාඩිය දානවා, difficult, උස්ම ගන්න අමාරුයි, නිකන් මැරෙන්න යනවා වගේ feeling එකක් එනවා with මිනිත්තු 3-4ක් වගේ වෙලාවක් තියෙනවා, right? When you get increased anxiety, you can get these panic attacks, right? These panics, because the uncertainty can increase the anxiety symptoms, and when you have increased anxiety, you can get those panic attacks. Think about yourself. Are you depressed during this period? What do you mean by depression? Vishadaya. Vishadayat ලක් වෙච්ච අය කොච්චර ඉන්නවද during this pandemic? How do you diagnose that? Some of you may have sleep difficulties. You find it difficult to initiate the sleep, right? I will discuss this at the end. Just to give you a few symptoms, you feel low, that it's no kick to continue your works. Then you feel not interested in taking your meals. You find it difficult to concentrate your works. Then think, am I really depressed? Right? Then some other people, they might have increased substance use. They might use in alcohol, cannabis, ganja, cannabis using, might go and take in some other several ice, heroin, several other substances to cope up with this stress. Or else, if you are a person who has a pre-existing mental conditions, think about that you are taking treatment for some kind of a mental illness. During this period, these can get worsened. Why? Because you may not get a chance to go and meet a doctor. Might be not available medications. So your pre-existing mental conditions can get worsened. Right? Then we have to think about, now according to this, now you have several stress in your life, right? This COVID has caused you several added stressors to your life. Then we have to think, okay, now we are having the stresses. How am I going to manage this stress? Because what do you mean by stress? Stress means actually it's a part of everyday life, right? We get stress during various situations. And in a way, what do you think? Do you think that stress is always bad? Right? For example, we will go into this. Have you heard about Yerke-Dodson, the curve? This shows you how our stress and the performance, what is the relationship, right? Stress එක වැඩි වෙනකොට your performance will increase. Performance වැඩි වෙනවා එක මට්ටමකට, right? It will increase during the initial period. When you have a stress, you can perform well, right? But at a point when stress comes to a peak level, then after that, if you have persistent stress, then your performance will deteriorate, right? So by looking at this, you can get an idea that actually stress is not always bad, right? In a way, it's good. You can increase your performance. Think in a positive way and look at the stress as a positive way, right? This is a helpful thing which we can get into our life and we can increase performance. But the problem is when you are unable to manage the over stress, then it will be a problem, right? Then we have to think what are the things we have to do. Think about your stress as a bucket, right? Now you have a bucket full of stress. You get the rain of stresses. You get worries, stresses, anxiety, trauma, everything will rain into your bucket. Then normally, right, in your normal life, what you have to do is you have to some holes in your bucket. So you can leak some stresses. These holes are, you can engage some hobbies, you can do relaxation music, can rest, can talk to the others. These are some stress leaking points which you can engage. Then there will be a balance in your stress bucket, right? But what happened with COVID-19? These leaks in the bucket have clogged, that you can't leak the stressors. And the rain is too much, like in these days, right? The rain is too much and the bucket is full of stressors. Then there is a disbalance in your coping and the stressors. Right? So when you get stress, how you are going to cope with that? What do you mean by coping? Coping means the ways in which we respond to or manage stress. When we get a stress, how you are going to face that, right? It's not something big psychological phenomena. It's normal day-to-day thing, right? When we get a stress, how you are going to face that? Or when we are getting an uncomfortable emotion, how you are going to face that, right? This coping, the various people might have various coping mechanisms that we can't say this is the best coping mechanism, because it's something depend on the individual. Something best fit for you might not be with the others. But in your coping, there can be some adaptive coping mechanisms and also the maladaptive coping mechanisms. They are adaptive. They are very good coping mechanisms. When you adapt to those coping mechanisms, you can continue life without most of the problems. You can do yoga, exercises. You can listen to music. Right? Maladaptive. Some people may, when they get stresses, they go and take some alcohol or they take cannabis, or else they may displace their stress. The displace karna kya hai? If you are a father, right, you are having a huge stress in your workplace. Workplace ke stress එක තියෙනකොට you can't go and scold to your boss. Boss to baninna bad, so you come your home and you are doing these things to your kids, right? You displace your anger towards the people that whom you can show your anger. Those are the maladaptive coping mechanisms people are having. But what you have to improve is the adaptive coping mechanisms, right? Okay, then it's very important during this period to look in after yourself, right? How you are going to look after yourself during this COVID pandemic. It's not only your physical health, but also mental well-being and social well-being. Okay, now we discussed about that there are several reasons, right? Why the corona period we can get the anxiety. There are a few things that you can do to minimize your anxiety. Actually, this is that the limiting the news coverage. Actually, I think that this was during the initial period of the COVID-19. All of us went to the TV, always watching the news, always go and search in the internet what's going to happen. We are overwhelmed with news, right? This can increase your anxiety. But I think now these days, actually, we don't go and check news every time, right? So what you can do is you can allocate a separate time, or you can allocate 20 minutes per day that I'm going to check news. Or else you can limit into particular broadcasting. Those are things you can do to limit your news coverage. Don't go and read everything, right? Every news that you want to do, you do not want to miss anything, right? Then it can increase your anxiety. Other thing is, try to distract yourself. අපේ brain එක ගත්තහම අපේ brain එකට thoughts දෙකක් එකපාර control කරන්න පොඩ්ඩක් අමාරු, right? We have it is struggle to hold two thoughts at a time. So what you can get the benefit from that. So when you get a bad feeling, you can listen to music, you can play guitar, play violin, you can cook something new. You can bake, right? You can go and jogging. Several things. Try to distract yourself other than being in the anxiety. Thinking anxiety, COVID ganama hita in natuwa. Try to distract yourself, right? This is very important. Connect with others. One problem is actually this is that you may not be able to pop up around and meet your friends as pre-COVID period. But what you can do is at least you can give a telephone call to your friends, or you can be with them in the social media in an effective way. Connect with others in safe ways. This can share your fears or talk about, or you can talk nothing with them, right? It has shown now you are depressed or you are having several anxiety symptoms, right? Now I think, okay, I am the only one who is getting these symptoms. No one else getting these symptoms. මට විතරමයි මේ symptoms තියෙන්නේ. මම විතරයි depressed වෙලා ඉන්නේ. මට විතරයි මේව තියෙන්නේ. Then you can go and talk to your colleagues, right? Your telephone call and ask, hi, how? But remember in mind that you have to talk into trusted people, right? You know in your life that you have some trusted people. Then check with them. How do they feel? I'm sure that you will be able to click with some of them also having these worries, fears, right? Then you get an idea, okay, I am not the only one who is getting these symptoms. The others also have these symptoms. Then you try to give help for them. Then only you are trying to think about things. What are things that you can do, right? To minimize the stress of them. අපි ගැන හිතලා කරනකොට අපිට මතක් වෙන්නේ නැහැ මොනවද කරන්න කියලා. But when you think that I am going to help my friend කියලා හිතුවොත් එතකොට ඔයාලට මතක් වෙන්න පුළුවන් various things what we can do, right? එයාට listen කරන්නේ කොහොමද? ඒගොල්ලන්ට වෙන activities ගැන කියලා දෙන්නේ කොහොමද? Then automatically those things can imply into your lives. So connect with others is a very important thing to minimize your stress during this period, right? And another thing is that pay attention only to what you can control, right? You think now you are paying attention to what you can't control. Think හිතින්නවා COVID-19 කොහොමද මම COVID-19 හැදෙන එක නවත්තන්නේ? ලෝකෙට COVID-19 යන එක වළක්වන්නේ කොහොමද? Can you control this? What you can control is your behaviors, right? ඔයා ඒක ගැන හිත ඇඳට වෙලා කල්පනා කර ඉන්න එක ඔයාට නවත්ත ගන්න පුළුවන්, right? So pay attention to what you can control. You can't control the crisis of COVID-19, but you can control your own responses and behaviors to it. Think ahead and make plans for what you can do, right? And the other important thing is be nice to yourself, right? What we are all doing is we have forgotten ourselves during this period. You know, some people, they have not washed their faces for at least ages because, right, they are not going out the house. So they have not paid any attention to your self-care and not paying any attention to yourself. But that's not the thing, right? You have to pay attention to yourself, right? You can allocate some time how you are going to relieve your stress. පොඩි වෙලාවක් දවසට වෙන් කරගන්න කොහොමද ඔයා stress එක manage කරන්න කියලා. ඒකට distract කරන මොනවා හරි එකක් කරන්න පොඩි වෙලාවක් වෙන් කරගන්න. ඒක important, right? Then whenever you need treat yourself, you treat yourself. If you want to enjoy, then you enjoy with the existing restrictions, right? Keep it in mind, to existing restrictions, you can enjoy. And have hope always, right? Now you can keep the big picture in the mind, but always think, okay, our university is going to open, right? I'm going to go there and I'm going to work as the pre-COVID era in recently. Have hope. නැත්තම් කොහොම කඩාවැටෙනා වගේ ආයෙ කවදාවත් මට නම් යන්න වෙන්නේ නැහැ ගාලා හිටියෝ you get more stressed and you will lead into several other psychological problems, right? So have a hope. And it's important to stay healthy during this period, right? How can you get healthy? Healthy means not only your physical health, as I mentioned earlier, your mental health also. You can eat healthy, right? Don't skip your meals, because what we are doing is when we stay at home, we try to, because we getting up at around 12 noon, so we skipping meals. That's not good for your health. Have a routine, right? And don't skip meals and drink enough water and try to stay active, right? There are a wide range of, if you want, you can use some online TV exercise programs or develop your own workouts, right? Then you can engage in those activities. It's not only now you are doing exercise කරනකොට අපේ ඇඟෙන් එනවා endorphins, right? Endorphins ආවම ඒක අපිට උත්තේජකයක් විදිහට natural උත්තේජක තියෙන්නේ. දැන් අපි cannabis අරගෙන කවුරු හරි ගංජා අරගෙන ගන්න උත්තේජකයක් වගේ ඇඟ ඇතුලේ normal natural උත්තේජක නිපදව ගන්න පුළුවන් ක්‍රමයක් තමයි doing exercises, right? So we will get kicked, so you can engage your works if you have a daily routine of doing exercises in the morning, right? And sleep is very important. As far as you know, that sleep is one of the major concerns in the mental health issues. If you can't get a good sleep, because our brain that works most of the time during the sleep, so try to get enough sleep, right? Don't watch movies the whole night thinking that I'm going to relieve my stress by looking at a movie. The whole night you are going to look at those things. Don't do those things, right? You get a good sleep and avoid substance. If you are trying to get alcohol, cannabis, those things actually can increase the anxiety, because the chemical effects of them also have an effect upon our body that they can increase the anxiety and several other health hazards to our life. So try to avoid substances. Then make plans in your life, right? Because making plans is very important, but the thing is they have to be realistic. යථාර්ථවාදී වෙන්න ඕනේ ඔයාගේ plan එක. මම අද දවස් ඇතුළත මුළු syllabus එකම cover කරනවා, පාඩම් කරනවා, ඔක්කොම ටික. Like that you can't make unrealistic plans, right? It's one of the major things which lead to anxiety. Then unrealistic plan එකක් හදාගෙන වැඩ කරොත් end of the day ඔයාට ඒක complete කරගන්න බැහැ නේද? එහෙම වුණාම මොකද වෙන්නේ? then දවස් අන්තිමේදී අයියෝ මම මේක කරලත් නෑ අර කරලත් නෑ. Then you get nervous, anxious. So make plan, get a piece of paper and write down the things that you are going to do in a day, right? Then you can tick when you have completed the things, you can make a tick. Then it actually gives a self-satisfaction to you, right? Try to do those things. Actually, these have worked for the people. We ask to do those things in our clinic patients. Actually, they have worked. So you are very educated population, the university students. So you can do those things and try to minimize your anxiety and try to get a good outcome from those things and having a routine, right? They are the very important, the hoarding of anxiety and the worry, right? Preparing a timetable. You feel like, okay, preparing timetables are kids' work. No, they are not. Right, the professors and the senior people also have done those things, and they have shown very effective to make a timetable and to go with those timetables. Then only you can think what are the things you have to do. You can allocate times to watch television, eat, exercises, maintain the normal sleep. Then only you get an idea. Otherwise, you go on doing things and things. Then the end of the day, you have done nothing. Only you have gathered the anxiety and the depression symptoms, right? So now these days you are at home, right? So try to work well from home. This has become the standard for most of the people. most of the university students also, this has become a standard nowadays. So have a separate place. You keep this place nicely, and in the morning you go out and get fresh air and have, as I mentioned earlier, have some simple goals in the morning and try to fulfill those things, right? Then after that, get ready for the work. And then, right? You have to make yourself, keep yourself properly, wash your face, brush your teeth. Those sensations, you have to pay attention to those things, right? And connect with others. You can give a telephone call to the others and check how they are. Right? Talk with them, talk your concerns, and listen to them. And I mentioned earlier the helping others. It's a very important thing, right? To minimize your stress, because you can listen them, ask how they are doing, and build a support. You can build up a supportive groups. You may have some trusted friends. Then talk with them, right? What they have found. Are they stressed? Or what you can do collaboratively with them, right? Then they will help to minimize your stress and you can have a better life. But the problem is now, these are simple tips that you can do, right? Now you are having all of these things. There might be few of us who has difficult to cope in your life, right? The difficulty to cope, are you depressed? As I mentioned earlier, you have to think. depression වලදී මොකද වෙන්නේ? ඔයාට හිතෙනවා කිසිම දෙයක් වැඩකට නැහැ. කිසිම සතුටක් දැනෙන්නේ නැහැ. හරිද? එතකොට වැඩවලට අවධානය දීලා කරගෙන ඉන්න බෑ. concentration, attention ඒව ඔක්කොම නැහැ. මේවා ඔක්කොම නැති වෙන්න පුළුවන්, but you might have some of these symptoms. එහෙම නැත්නම් you get your sleep pattern change. depressed අයගේ ගොඩක් වෙලාවට sleep cycle එක change වෙනවා. early morning දෙයම නැගිටට හැරෙනවා. ඊට පස්සේ ඔයාට නිින්ද යන්නේ නැහැ. ඒකේම කල්පනා වෙනවා. right? and they පැත්ත පෙරලෙනවා, මේ පැත්තට පෙරලෙනවා, නිින්ද යන්නෙම නැහැ. ඒක ඊට පස්සේ memory එක නැහැ. කලින් මතක තිබ්බ පාඩම් කරනවා දැන් මට මතකම නැහැ. right? those are symptoms. and your appetite, ඔයාට කන්න හිතෙන්නේ නැහැ, කෑම කන්න හිතෙන්නේ නැහැ, ඔහේ ඇඳට වෙලා ඉඳ හිතෙනවා, කට්ටිය එක කතා කරන්න හිතෙන්නේ නැහැ, right? Those are some sinister symptoms of depression. Think whether you are having these symptoms, and especially the thought of suicide, right? We have seen several people at our clinics with suicidal attempts during these days due to the stressors, and they find it difficult to cope up with the stress in better way. right? ඔයාට හිතෙනවද මැරෙන්න plan කරලා තියෙනවා, right? those things. and worsening of anxiety symptoms. මම කලින් කිව්වා panic attacks වලදී මොනවද දෙන්නේ කියලා, right? so ඒව තියෙනවා නම්, if you have these symptoms, actually you also have noticed that it's very difficult to cope up with your things and difficult to continue your day-to-day works, right? then actually you need professional support. So we welcome all of you at Teaching Hospital Peradeniya. If you have any concerns, you can come to our clinic and mention your concerns regarding your mental health issues. We are always here to help you, right? But not every one of us having those symptoms. There's only a limited number of people who are having these symptoms, but others, they can do whatever the things I have mentioned to have a better life with you, right? To have a better, to minimize the stress. And don't worry that you are having stresses, right? These are normal human emotions that every one of us can get those emotions. The problem is, if you find it difficult to manage those things, and if you have a great effect on your life only, there will be a problem. Otherwise, don't think when you get stressed that I am going to be mad, right? So try to implement those tips in your life, and I think you might get a better life future. So I think you got something from this, and you will going to implement those things, right? Thank you. And if you have any queries, so this is the time for that.
Thank you, Dr. Dilini. So anyone, you can ask your questions either in English or in Sinhala as well. You have any questions?
If you have any queries, you can ask Sinhala or English, right?
While others come up with the question, I have a question.
Yes.
Is it okay if I go ahead? Yeah,
Yes.
so
Yes,
you
sure.
mentioned, you mentioned you said a lot of solutions to cope up with anxiety and some long-term solutions. But like, say if someone is going through a panic attack, what should that person do? Like any short-term to relieve or to snap out of the panic attacks or something? Do you have any suggestions?
Yes, the thing is actually if you have the general symptoms of anxiety, what I have mentioned, right? If you can cope up with, if you're having these symptoms and you can cope up with these things, that's fine. But simply, if you are getting the anxiety symptoms worse, I think that you have heard about the relaxation exercises is one of the things that you can implement. Relaxation exercise means go to a very relaxed place, right? And sit calmly there. Then keep your right hand at the chest and keep your left hand in the abdomen. Then close your eyes. Then after that, pay attention only to your breathing pattern, right? Then you can feel how your chest and abdomen are moving, right? So this is something that you can practice. But the problem is, this is a relaxation exercise. There are several other relaxation exercises. These are some psychotherapeutic things, right? Psychotherapeutic things are not going to give you an effect suddenly. If you are going to take a medication, that will give you an effect suddenly, right? There are some medications that we can give with the worsening of anxiety symptoms. They can have you can get an effect within 1 week, or there are some medications you can get at the same time, but the effect of doing the psychotherapy is long duration one. So you can practice. If you are getting anxious, you can go to a calm place and you can do the relaxation exercises, but they have an effect in the long run, right? But if you find it difficult to cope up with the stress, and if you are getting panic attacks repetitively, right? You get one panic attack per day, then you find it difficult to tolerate that. So you have to take the professional support. You have to come to hospital or wherever the place and to get a medical opinion. Did I answer your question?
Yes. And I just have one more question. So it's good to know that, okay, I might say like one person or myself, I am having a like difficulty with mental health, but say someone that I know, if someone that I know is having any kind of mental health issues, and dealing with, especially when it comes to COVID-19, how do I deal with it? How do I, I cannot just say like, okay, things are going to be okay, and they're not going to understand, or they're not going to be okay with it. How do I deal with that kind of situation?
Yes, that's a very good question, because sometimes you might have encountered that one of your friends having these symptoms or one of your relations. First of all, you have to talk with them and listen, get some time and listen to them, right? What are their concerns? Now you know what are the things that they can have. If they are telling that they are having the normal anxiety symptoms, they feel a bit of uneasy and find it difficult to continue with their day-to-day routines, then you can tell what are the simple things you can do, right? But the problem comes when the patient, when your loved one, your relation is having some depressive symptoms. I think I have mentioned them, right? The patient, the one is having sleep problems, suicidal thoughts, and difficult to control their anger. And if the patient is having risk to themselves, risk means suicidal risk, those things, right? Or the patient is having a risk to someone else. Can අනිත් අයට මොනවා හරි problem එකක් වෙනවා, right? ගෙදර ඉන්න ළමයින්ට කරදරයි, ගහනවා, වයින්නවා, ඒව කරනවා. එතකොට if his behavior has caused some effect on the person itself and also the others, then you have to take the medical opinion, right? Then the other thing, the worsening of the anxiety symptoms. Then it's normal to have anxiety symptoms in each and every one of us. But when you need to go and take treatment is when it disturbs your life. That means you cannot concentrate anything. You are getting panic attacks. You haven't done any of your assessments or any of your homework. If think about a housewife that she find it very difficult to engage in her household activities, for this example, and she's not engaging with her kids caring and other things, right? Then when they have seen a great functional impairment in the patient, then you have to listen to them and grab those things and offer them to go and meet a proper help, proper medical health from anyone, right? Then other than that, if they're having normal things, normal stressors, which are not going to affect their day-to-day life, then you can implement the simple tips. Is that what you want?
Yes, ma'am. Thank you.
Yeah, doctor, how we could recognize a student in the class if he is having this kind of symptoms? Because they are not responding usually when we are teaching, maybe especially in online teaching these days. So is there any way we can recognize that sort of thing?
Yes, the problem is that with this online teaching that we might not be able to catch most of the people, but we can give a try, right? One thing is that that mood during your sessions. I don't know what are the things that you are going to ask. If you ask in some questions, those things, if you feel like that the student is not concentrating at all, right? Or if he cannot remember the minute points, then you could have a suspiciousness whether this student is having some kind of problem. If you have a way that you can, I think there are some student counselors and those things, so you can direct those students to them, then actually you need to talk with those students, right? And to elicit what are the symptoms or what are the worries they are having. Then only that you can take. Initially part actually you can't diagnose, but you can have a suspiciousness whether this patient, whether the student is not concentrating, whether sometimes when you're talking we feel that the mood is not good, right? Then you can direct the student to someone else, or if you can talk with the student, then you can elicit those things. And if you always we have the suspiciousness only we have to do a proper clinical assessment of those students.
Okay, thanks.
So I have this question. Since we are doing most of the things online, so it is very easy to distract ourselves. Like there are so many social media, even YouTube. So there are so many options for us to choose to spend time with. Even some of us tend to use social media as a relaxing, do those things to relax sometimes. So sometimes I feel like people get addicted to those things, like social media, even YouTube, because those the applications also, they are developed in such a way so that we spend so much time on them. So do you have any advice for people who spend so much time on social media so that we can limit it and we can have a kind of a limit to ourselves to engage with those things?
Yes, actually considering the social media that it has both effect, that you can use it to relieve anxiety, as I mentioned. The problem is if you are going to get addicted into those social media or playing games, those kinds of things, they have become one of the biggest problem in these days, right? The thing is now, how we talk that for comparing with the people that who are taking substance, right? This is not a person who is going to take substance. They initially take a small amount, right? Then the brain chemistry, how it works is it release some kinds of endorphins, which give us a kick to take another shot, right? Then that is how, when you are playing with games or when you are engaging in social media, maybe during the initial period that they are doing those things for a few minutes. Gradually, it can worsen. So I think the prevention is better. So it's better to tell your students, now when you are using the social media, you have to limit your time, right? Actually, what we are doing in our child and adolescent clinics, we ask the parents. In university students, actually they are adults, so you can directly tell them. What we are telling is to limit, think about a day, you can use the social media only for 20 minutes duration, right? For whatever the reason, don't use it more than that. What happens is if you are going to use it 30 minutes, then next day it will go into 1 hour. Like that, the time duration will increase, because actually we know that that we get some kind of a happiness when we are engaging in those activities, right? Then initially that's what happening. We get some happiness in our internal brain. Then our brain circuits change with that. Then you can't change it once the brain circuits changed, right? That means you got addicted to those things. In that kind of situation, it's very difficult to turn back. So it's very important during the initial period, you have to educate your students regarding using the social media or the other things, not for the educational purposes, but for the relaxation, watching movies, those kinds of things. Relevantly, you can say that for how long, 1 hour per day or 30 minutes per day, like that. Regular routine should be there with the social media and the other internet things. Otherwise, when it's going to the addiction thing, it's very difficult to reverse those things. With medication also, actually, it's not going to do a good job.
Okay, thanks.
Is there time for one more question?
Yes. Yes, sure.
Okay. Dr. Dilini, my question is regarding that you mentioned it's a good practice to exercise when you are stressed out. So in a case where you are stressed out because of time pressures, when you take time out to exercise, wouldn't it add to the stress?
The thing is this, right? Now, everything you have to plan at the beginning. Now think that you may be not able to, that it's that think about, there are several people, right? Think about a person. Now he's going to start the life that he's not very much stressed during the initial period, and he's having some stressors, but he can cope up with these things. In that kind of a person, that he can allocate time for exercise. Exercise means not doing the whole day. That's only for 15 minutes per day, right? Then you can make a routine and every day you are doing the exercises, right? That's one person. And there might be another person that, in your case, that is very depressed due to the time frame. But doing exercise is one important thing. I think I mentioned doing exercises. One thing is you can distract yourself, right? Now, your problem is you are overwhelmed with your works, that you have to do several works. Your time management is the problem. But you are spending only 15 minutes per day. By 15 minutes, the gain which you can gain from doing exercises is much more than losing that. One thing is you can distract yourself. One thing is when you're going to engage in exercises, that's not going to happen suddenly, but your brain system releasing endorphins, which give you some kind of a happiness, right? Then you feel like to continue your other works. So forget about losing that 15 minutes and think about the gain gain of that exercise doing only 15 minutes, because I think allocating 15 minutes when a person, whoever the one that is having time management problem, won't be a big issue, isn't that?
Yes, Dr. Thank you very much for that answer.
In the absence of any other questions, shall we wind up the session now?
Yes. Let me propose the vote of thanks for this session on behalf of the Central Chapter of Women in Logistics and Transport and Chartered Institute of Logistics and Transport, Sri Lanka, and the Department of Manufacturing and Industrial Engineering, Faculty of Engineering, University of Peradeniya. So first of all, I would like to spend my most sincere thanks to the speaker today, Dr. Dilini Vidusha, Senior Registrar in Psychiatry at Teaching Hospital, Peradeniya, who is also a lecturer in Faculty of Medicine, University of Peradeniya. Thank you so much for your vital time, despite your busy schedule, to make this event a reality. So I also want to thank the organizing team for this event, for their support and efforts towards making this event a success. And also I thank the participants of this event for their valuable time. Thank you so much. So we expect you all stay safe, and so let's wind up the session. Thank you.
Thank you.
So this concludes our webinar. Thank you, everyone. Stay safe both mentally and physically. Thank you.